Hello all, my name is Robert Zamora, and today we'll be discussing the Cuban Cost Plus Drug Company. Cost Plus Drugs is a company founded by radiologist Alex Oshmiansky and philanthropist Mark Cuban in early 2022, making it a very young company at this point in time. However, before we get into it though, let's first talk a little bit about the industry. As we can see here, the pharmaceutical industry works as a supply chain with many moving parts, much like any other industry. Manufacturers discover new drugs and do extensive research and development until they are approved for public use by the FDA. From this point, this is where the wholesalers and pharmaceutical benefit managers come in. They buy from these manufacturers and market these drugs. The wholesalers are the ones that provide drugs for pharmacies and retail, while the pharmacy benefit managers can distribute to their patients based on their health plan through their respective pharmacies, fulfilling their prescriptions for patients' doctors. The system isn't necessarily bad in how it operates. However, the state in which we find the pharmaceutical industry is less than ideal for most Americans, because most of these wholesalers that make up most of the pharmaceutical wholesale market are only three companies: AmerisourceBergen, Cardinal Health, and McKesson, making up well over 90% of the wholesale drug distribution in the United States. These manufacturers of generic drugs determine the prices they charge for these drugs, as well as the wholesalers and PBMs marking up these prices in order to generate revenue. This is something that has great impact on those dependent on these drugs for whatever condition or illness needing treatment from these drugs. With the majority of the pharmaceutical market in the hands of the big few, the struggle to find affordable drugs is becoming more difficult, especially with laws and policies meant to hinder extraordinary price hikes constantly being implemented and repealed. It is hard for many Americans to get the proper medication that they need for survival, and it goes for a good chunk of the country. The ones most affected by the current state of the pharmaceutical industry are those in the middle to low class in the United States, those who can't get adequate insurance from employment and don't make enough to afford out-of-pocket expenses, as well as those who make enough to barely not qualify for government assistance, of course depending on where you find yourself living in the country. These Americans deserve a solution that will work with them by giving them a simple process in ordering prescription medication and getting it at the lowest price on the market. There are ways to get prescription medication, though the ease is relative based on your definition of what ease means. There are three main methods in distribution of prescription drugs. These methods offer different advantages and disadvantages. The direct-to-patient approach is the simplest of the common forms of distribution. From the drug manufacturers, wholesalers purchase drugs in volume and distribute it to pharmacies based on the needs of the patients, according to what their insurance covers. This chain has no third-party entity that is supposed to look in favor of the patient, like what a PBM would be. So the likelihood of patients paying out of pocket for medication that is not insured is very high. The conventional chain with PBMs is a typical chain that most patients go through with their health plan, insurance, or out of pocket. From before, the drug manufacturers negotiate rebates with the PBMs, which act as a sort of discount so that PBMs get bulk volume from manufacturers. In return, PBMs negotiate formulary placement, which means that PBMs get specific formulas of the drugs, so sort of like an exclusivity. The PBMs thus work with the patient's health plan so that the drugs are needed and can be fulfilled by these PBMs and distribute them to the pharmacies where the patients purchase these drugs. In essence, the PBMs can cater to the needs of the patient working with their health plan. However, the middleman of the supply chain results in the patients still paying considerably high prices, especially if the medication is not covered in their health plan, which happens often many times. Though patients can often get formulary exemptions for medication that is not in their plan, though it would need to be approved, but is not always guaranteed. This distribution method is of course the most complex and prone to issues, whether it comes to getting what the patient needs, though it is more in favor of the patients financially. Telemedicine is a cheaper form for patients, which involves patients that communicate with their medical representatives through digital services and getting medication prescribed online. This method follows more of the direct-to-patient method, though telemedicine services are able to work more with the patient and help them get better prices. However, the issue with these services is that the relationship between doctors and patients is very distant, which means that the likelihood of patients not being able to properly express all symptoms of a sickness or doctors misdiagnosing patients is high compared to other methods. These are the major players in the fulfillment of patient prescription medication and come from many backgrounds. GoodRx is a competitor in helping patients find the cheapest medication available at certain pharmacies. OptumRx is a PBM that helps patients of the United Health Group in getting medication. Though may be difficult in medication, need is out of the insurance loop of United Health. Civica is a close competitor that Cost Plus Drugs has, being not-for-profit and getting prescription at a low price directly to the patient. However, Cost Plus Drugs is the better solution to the growing issue in the pharmaceutical industry, advocating for the benefit of the patient in a financial and ease-of-use aspect. Cost Plus Drugs takes the easiest method of drug distribution, going directly from the manufacturing to the patient through mail delivery. Utilizing the simplest method of distribution allows for them to charge the least out of the entire competition, giving the value back to the patient, and they are selling nothing more than generics or medication to treat various illnesses and conditions at a low cost. Our company is the only company that can say they sell generics at the lowest price on the market. The front page of our website says it all. It encompasses all of what Cost Plus Drugs does for its customers. The phrase, "no middleman, no price games, huge drug savings," is a direct attack on the competitors in the industry that price gouge generic drugs to make a hefty profit. With many entities taking part in the system and profiting off those who need medication, solidifying their brand as one that looks as those who cannot afford to pay ludicrous prices and sell prescription medication at a reasonable price. The front page even shows certain drugs at market price and the low cost that Cost Plus Drugs charges for the same generic drugs. Their medication page shows all medication that is available for the patients, making the process simple for patients to see if Cost Plus Drugs carries what they need. The process being made as simple as it could ensures that patients are satisfied with using the website, and with the creation of an account that allows them to save their medical history, incentivizes them to continue to use the website for their medicinal needs. The process is made simple for finding that drugs you are looking for, and once you've found it, you can adjust the dosage level as well as account according to what your prescription may say. The easy to use user interface of the website not only makes the user experience exceptional, but the simplicity of the supply chain and its transparency are easily found with every purchase made, with the total cost of the manufacturing of the drug, the 15% markup of the drug to support operations, as well as a $3 pharmacy processing fee, which is standard with every pharmaceutical need being handled through the industry. The shipping is also included once it is calculated where in the country it is being shipped. Not only is the price the lowest offered in the market, it is also clear why it is priced in the way it is so that patients have the peace of mind that the price covers all necessary operations of the business and not going into the pockets of large corporations as profits. This model for a prescription drug distribution service is something that was not possible for decades, and now the further utilization of the internet has allowed for Cost Plus Drugs to serve a loyal customer base by creating an easy-to-use platform, making the process for a patient to receive their drugs as seamless as possible. Getting the word out, on the other hand, is a very simple process. It has been adopted by the Cost Plus Drug Company and is in fashion that reflects the company very well. This here is a Facebook page, which is used to consistently notify their followers how they are doing, things such as new assortments of drugs they now carry and price drops for the drug that they do carry. This simple method of advertisement showcases the mission that the company is pursuing, which is to make generic prescription drugs as affordable as possible for their customers, ensuring that they are cutting costs and passing savings to the customer is a great way to get the good word out. Keeping this aspect of promotion for our services ensures that those who use them are satisfied and can prompt the much important word-of-mouth referral, ensuring that new customers are aware of the great benefits that Cost Plus Drugs has to offer. This is what is offered on their YouTube and Instagram page, which you can see Instagram shares the similarities of their Facebook page. However, there is a liking in the YouTube arena, which I think cost plus drugs should utilize more effectively in order to expand their outreach. A way I can think for YouTube to be utilized effectively would be to document real-time expansion of the company, like how earlier this year their new manufacturing facility in Fort Worth, Texas was completed. Utilizing the AdSense of Google can help to get the name of cost plus drugs into the reach of more people. The more effective marketing that we can use, the more people that can benefit from the low cost offered for necessary prescription drugs. To conclude, the most important way to measure that the company is succeeding is that there is always a constant flow of people taking advantage of the great benefits that cost plus drugs has to offer. Utilizing more methods of informing the public of the cost plus drugs mission can have a greater impact and reach more people than the current state of outreach. However, as long as there is effective marketing that displays the transparency of the company, offering an easy to use customer interface at a low price on the market, the Mark Cuban Cost Plus Drug Company has a great platform and can only rapidly grow at this point in their journey, solving the current difficulties that many middle to low class Americans are facing by pharmaceutical conglomerates. These are my sources. Thank you all for your time.